once again, you're watching QTV and you're watching the Week in Review. I'm your host, Adi Darami, and as ever, we go through some of the big stories from the week, and I always have a very special guest with me to go through the stories, and this week really is a very special guest, none other than Issa Jallow, formerly of QTV. Issa, welcome to the program.
Thank you, Mr.
And thanks for coming. And as I said, we're going to go through some of the stories, and most of them are really big stories, but we're going to go through them in depth. In case you're just joining the show for the first time, you'll see how it works. Pick a story and then we'll analyze it. And so let's crack on with the very first one. Let's watch this video and we'll see something to do with the government's food relief program.
This is the scene at the Makati Square in Banjul, where trucks are lining up to be loaded with their share of the distribution exercise. President Barrow's government said the food relief package is expected to reach every household in a time of slow economic activities brought about by the COVID-19 related emergency measures. As part of the distribution and monitoring mechanisms and to ensure safe delivery, security personnel are accompanying these trucks. On hand to monitor the progress of the loading exercise was the Vice President, Dr. Aissatou Touré, who was later joined by President Barrow, who took a surprise walk out from the palace to the square. Speaking to QTV, Dr. Aissatou Touré, the Vice President who doubles as the chairperson of the Cabinet's Committee on COVID-19, says food transportation has been going on since last Monday.
There you have it. Food transportation has been going on since last Monday. I didn't know that, and that's one of the reasons why we sent somebody there to check on exactly what was happening. Issa, you saw that clip there, and you would have heard about this food distribution. What are your thoughts on how it's being handled, first of all?
Well, handling, for sure about that. But I think it's a massive exercise at the moment with the government coming with these loads of consignment of food, trying to distribute across the country. I don't know logistically how they're going to do it, who they're going to give it to, and how are they going to assess who actually needs it and give, because I know not everybody can get it. I understand they said up to 80% African population.
85%.
85%.
That's right.
Which I think it's a very, very high target. I don't know whether.
Right. Well, luckily I can tell you, they're using the likes of governors. They're using also authorities, local authorities, because they think that local authorities somehow have some of the best records in the country, and so they're going to be delivering them to, various, for example, governor of URR, and the military are actually going. They're accompanying each one to make sure that the distribution is done in a fair manner. Senegal started theirs earlier in this week. I think ours was Monday, according to the Vice President. They started theirs on Tuesday. And I did want to ask government, as to, how they're going to do it. But I just wondered, for you, because you've kind of touched on it, what would be a fair way of distributing? We have this 85% and the other 15%. People like you and I probably won't get it. But, what would be a fair way as far as you're concerned?
Well, there has to be a needs assessment. I don't know whether that has been done. And, somebody actually going to work and coming back doesn't necessarily make that person self-sufficient in terms of food.
Correct.
So I don't know how, for example, if the GBOS was involved in taking statistics as to doing a survey, looking at the people who actually need these things, and seeing what family needs what, to be able to give it in a fair way. I think that would be better. But for now, I think they're just going to be relying on local knowledge, and that could create problems. Yeah. I
mean, it's in Gambia, I've learned that people don't like being compared to Senegal. But again, as I mentioned, Senegal have already started theirs. Across the country, they're using 888 trucks. But what they're also doing is that they're issuing the food packages 30 families at a time to ensure that there is the kind of social stroke physical distancing. And I think also you've just mentioned that the Vice President said that they'd done an assessment. Well, nobody's told us how this assessment was done, how they arrived at the fact that 85% would get it and 15% wouldn't. But in terms of, do you see logistical nightmares? Again, you've sort of hinted at it in the sense of, if they haven't done the assessment, or if they have done, then how have they decided who should get it and who shouldn't?
Yeah, the logistical nightmare is going to be there, because if you go to the rural area, for example, in URR, you go to places like Woodley, there are settlements that are very, very far away from the main road.
Exactly.
Having to being able to get the consignment to those people, or them coming all the way from those villages to come and collect it, is going to create a huge logistical problem. I know of a little assessment that has been done by some councils, because I know, for example, BCC have been engaging on some kind of needs assessment. I don't know whether it was in relation with this or not, but they would be able to have a better data. But if you look at what is happening in, for example, CRR North and CRR South, it's a huge area. I don't know whether that council will be able to do that. And like I said, because those areas, the villages are so sparsely dotted, it's going to be difficult to have those things. And I don't know, it is going to pose a huge logistical challenge for sure.
Yeah, I mean, when I spoke to somebody, what they were saying is that as part of the whole sensitizing of the country about COVID-19, they tried to reach all the villages and towns and villages that they could, and they assumed that they were going to use the same methods that they had used to say, let's make sure that everybody in every corner of the country knows about COVID-19, knows about social distancing, knows about hand washing and so on, and use the same data that we used for that exercise, which is only just a few weeks before. And use, I mean, for you, is that something that kind of seems sensible?
That could help. It could help. It may not solve the whole problem. It could help. But then transporting the food stuff would be the problem now. To all, transporting 4 or 5 people going around doing some outreach activities is very easy. For the data collection, that could be easier. They can be able to spot all these settlements in these areas. But then if you go to a settlement also, you need to know how many people are there. Who needs it? Probably all those people need it. That is the thing. So who is there at that point in time, who isn't there? Those kind of things is going to be the thing that are going to pose some biggest problems.
I think what Issa says there is what all of us think is going to pose very big problems. This is something that I'm very interested in. How are they going to do it? Are they using drone technology to, find small villages and hamlets and so on? Keep watching. Next week we might have the answer, who knows, because they would have had about a week of distributing that. So, but thanks for that, Issa. And now on to the next segment. Now we keep talking about the fact that COVID-19 has forced us to assess everything from schools, how we do our education, but most of all, it's our health sector that has taken quite a hit and has shown up the shortcomings in that. But have a quick look at this, and this might be part of the solution. Just have a look at this clip.
We can't do all alone. Government needs support of philanthropists and other support groups like the Paradise Foundation. And I want to thank, on behalf of the government of the Gambia, I want to thank the Paradise Foundation and the management of Paradise Hotel for taking up this bold initiative. I understand this has costed $1.2 million, but then the cost is small compared to the satisfaction that people will derive from the use of these materials.
Talking about the Paradise Foundation and the donation that they have made to the fight against COVID-19, particularly in terms of strengthening the health sector. Now, Issa, just before that clip there, I was saying that COVID-19 has shown up many things. The biggest thing is shown up, not just in the Gambia, but across Africa, is our health system and how poorly resourced our health system has been. I mean, what are your thoughts on that, by the way?
I think the fortunate thing is COVID didn't start in Africa. It was going to be disastrous for us. But because it started in the most advanced places, we are able to look at it at a distance and be able to prepare now. For us now, it's more of a preventive measures that is more important for us. Because once we allow it to get here, it is going to have a big impact in our society. One, because people are still in denial in some quarters, and secondly, the health facilities that we have would not be able to cope. Looking at our own problems right now without COVID, our health facilities are not the best. If we have this added problem on top of it, it is going to be a big problem. But I think it has shown also how people could come up and see how to alleviate some of these things. And for now, for the Gambia, I think we are not doing bad in terms of preventing ourselves, although I'm still worried. about how people are taking it.
I think all of us are.
Yes. If you look at how people are taking this lockdown or social distancing, some people are not taking it seriously and are thinking that the Gambia can be invincible. Right. We were free from Ebola, but this one could be deadly if it comes around.
It really could be, and as you mentioned there, in terms of the health sector, in a way, it's been a good thing that these philanthropists have been stepping up, like the Paradise Foundation. I mean, I saw the range of stuff that they've donated to government, and it's quite impressive. And others have done so as well. So it's not just been, we've seen lots of hand sanitizers and hand washing stuff, but there's been equipment, and there's also been medicines that been sorely needed. But why did it take this for those businesses and so on to say, okay, let's give this to I mean, why?
Absolutely. That's the question, because it actually reveals a lot of generosity among individuals and institutions.
Sure.
But where was that, as you asked the question? Do we have to wait until we are about to face calamity that we are going to be generous, we are going to look at things that we need and we put it in place? I think these are things we should look at. Yeah. If we get out of this whole situation, we should look at our health system, we look at all the things that we need in terms of safeguarding ourselves in such things and try to alleviate it in a way that we are doing it now. Probably it is government responsibility to do a lot of things, but if we step in, for example, what we've seen other people are doing, the rehabilitation of the
sanatorium.
The sanatorium is a very, very good gesture, and I think it's going to go a long way in alleviating our health sector problems after, if at all we get out of this COVID-19.
And I think the debate is going on, I keep saying, not just in the Gambia, because I think sometimes we kind of look at things in isolation. But the same debate that you and I are having, they're having in Guinea-Bissau, because the Prime Minister and 2 of the cabinet have tested positive. And in Sierra Leone also, where the president tested positive and now is in self-isolation. Because what you have there is people are saying that had this not been a global thing, those people would have flown out of their country to another country, probably in Europe, for treatment.
Exactly.
But now they can't. They're forced to actually stay home and be treated at home. And that has shown up the fact that, at another time they would have jumped on the first plane out. And now they have no choice but to be treated at home.
Definitely. I think from now on, the investment in our economy, we need to look at how well we are going to invest in our health sector.
Sure.
This is not only in providing structures in terms of building, like we know, building structures and say they are hospitals. We need to put in equipment.
Indeed.
And we need to have to invest in the personnel. For example, the amount of money that is coming in, it can be invested in giving people who are interested in studying medicine.
Yes.
So that can help us in staffing our health sector, because probably around this area you might have a few private clinics here and there that people can have access to who have the means. Sure. But if you go into the rural areas, there are structures there, but you find there are no equipment and there are no staff.
No personnel.
Yeah,
absolutely. You're right. I mean, and I think this is something that, as Isa says, needs to be addressed. We discussed this in the office, and I hope people from government are watching, because I saw a pie chart this week, which was to do with government expenditure, and I was struggling to look for the expenditure on health. There were big ones for all sorts of things, education, the military and so on. And I think health was 6% of government expenditure.
I think it needs to be looked at very, very, very seriously. You see, it's only COVID that we're talking about now, but there are other serious health issues. For example, right now, you go to the hospital, if they tell you we are not seeing anybody except it is an emergency, because I remember taking my son to the hospital for some minor things that I am concerned with, and I was told, no, since it is not emergency, we're not seeing it now. So the health sector or our health facilities need to be equipped in such a way that if you have these things, it can take care of it, at the same time take care of other issues. Sure. Because there are people who have some other ailments and they need the health facility, and that is becoming a problem because everybody is busy on this COVID-19. Sure. I think the investment should be more into facilities and more also into personnel.
Sure.
Sure.
And I think that's a good point to end that particular discussion. Thanks for that, Isa. And there you have it. I mean, not just the physical buildings, but also train the personnel to work in those buildings. And now on to another favorite subject of mine, malaria. Have a look at this clip, and all will be revealed when we come back after the clip.
Due to malaria in hospitals and health facilities dropped by 74%, and deaths attributed to malaria have dropped by 90%. Furthermore, malaria parasite prevalence dropped from 4.0% in 2011 to 0.2% in 2014. Most significantly, the malaria prevalence has declined further to 0.1%.
As the fight against COVID-19 dominates the world's healthcare system, its impact has severely disrupted insecticide-treated net campaigns, and there is a 75% reduction in access to effective anti-malarial medicines. The World Health Organization has warned that in 2020, malaria deaths in sub-Saharan Africa could double from 386,000 to 769,000. The figure dwarfs the predicted death from COVID-19 on the continent.
That says it all. The figure predicted could actually dwarf the predicted deaths from COVID-19. Now, Isa, the reason I chose that, and I said, here's another favorite subject of mine, is that COVID-19 has so dominated our thinking that we forget about something like malaria, which kills many more people. When COVID-19 had infected 1 million people, everybody was like, oh my gosh, 1 million people infected. Well, guess what? 298 million got malaria.
Yeah, malaria is that silent killer, and it has been a devastating killer in this region for a very, very long time.
Indeed.
And it looks like it's still going on. Yeah. And because we are faced with this other problem, it looks like, as it is mentioned here, we are forgetting. Yeah. There's another killer just lurking in the background, and it's still doing its job. I think, like I said, our preparedness for such things is still lacking. I think just as we discussed, the investment part is very, very important in this. Sure. We know, for example, the MRC is very, very keen in research in malaria.
Into malaria vaccine.
Malaria vaccine.
Yeah.
But, that has been going on for years. And, we are getting into the malaria season now. The rainy season, when it comes in, if it combines with this COVID-19, it's going to be very serious, particularly with the children.
Yeah, I remember getting into a furious argument with somebody this very week because I said, and I'll say this on air, I said that the amount of money that the MRC spent on trying to find a malaria vaccine, if they had spent that money on cleaning up our environment, that's what we need to do to eliminate malaria. It's not about finding a vaccine. It's about denying mosquitoes the breeding places by keeping their environment clean. I mean, that's how other countries have eliminated it.
Absolutely, yeah, that's it. Because if you look at the situation of our environment in the rainy season, this is just breeding ground for malaria. And investing in cleaning up our environment would help in a great way, if not eradicate it totally. Because what people don't understand also, they think it's only the dirty water. Actually, stagnant water or even clean water that is left lying is a very, very good breeding ground for malaria. Shrubs and things like that, not clean. These are areas that mosquitoes can hide, and they can be very, very deadly. Yeah,
so there you are. They can be very, very deadly. Now we'll go for a quick commercial break. And when we come back, we'll be talking about something that's been very, very impressive and innovative. Join us after this break.
Your favorite mobile service has done it again. Now you can buy cash power with your QMoney account free of charge. Yes, you heard me right. For free. Nothing is cheaper than free, so start buying your cash power from the comfort of your homes with unbeatable services QMoney has to offer. With QMoney, life is easy. Visit your nearest Q-Money agent to cash in or call customer care on 133 for more information. Don't forget to wash your hands with soap after handling cash. Stay home, stay clean, stay safe. Q-Money. Sunyu Kalpe. We innovate, others follow.
When electricity goes off, even for a few hours, life is disrupted. Control your power and your life with the Perkins Texan Standby Generator supplied by Timber Company. When utility power is restored, Perkins Generator automatically shuts off and returns to standby mode, ready and waiting to protect your home. Perkins Texan Standby Generator. Reliable, quality, affordable, and efficient. Texan Perkins, supplied and maintained by Timber Company Limited, your answer to uninterrupted power right at your doorstep. Visit us today at number 60 Bertil Harding Highway, opposite Wyeth, for best fit solutions for you. Call us on 345-6789, 767-6769, or 767-6768. Feel the power with Texan Perkins.
Welcome back after that short commercial break. And now they say necessity is the mother of invention. Well, that is certainly proving to be the case around COVID-19. Have a look at this clip, and I hope you'll be as impressed as I was.
In the Gambia, work is in progress to produce COVID-19 related medical and personal protective equipment using local materials with the 3D printing technology. Shipping costs and delays in the supply of these much-needed medical supply are reduced at a stroke. In just a few hours, more than 6 dozen of these personal protective equipment can be 3D printed.
3D printing technology community is a very big one globally, and we gathered experience from what we see in other places and adapted it to what we have locally. Pulling these apart, for example, this band comes from a shop in Fajara. This comes from a shop in Caraba Avenue. And then using materials imported from Czech, we printed that in that room that you will see later with Mr. Truck. So putting everything together, we have this, and like the one you have there.
Very simple explanation as to what is happening. I mean, Isa, I don't know whether you were able to see that. I first became aware of it the day before we did the report when they uploaded a video and showing that previously this is stuff that we would have had to buy from abroad, and now it's being sourced locally using locally available materials.
Yeah, very impressive indeed. I saw the video on Facebook or YouTube or whatever,
yes.
and it was very impressive. And it being something that uses materials that are easily and readily available in our community is also a very, very good thing. And I think the idea of making preventative materials from our own resources, you know, will also help us manage our funds that we need to spend in some of these things. You know, if we were to buy it elsewhere. I've seen some other countries do this thing, and I was thinking, can Gambia do this? And all of a sudden, something pops up on there, and it's very, very impressive. I really, really like it.
And again, the refrain throughout today is that, why did it take COVID? So, you know, we could have been doing these things locally, sourcing them locally, and not buying them from abroad, but we were. Well, COVID-19, because you couldn't have shipments coming in of some of this material, they started thinking, well, what are we going to do? Okay, let's make it locally. I mean,
yeah, I think this is a general African problem, because I had one politician also talking about why Nigeria was importing toothpicks. You know, so if you look at things that are readily available here that we can utilize, we can easily make, and we don't need to import, but we are depending on foreign materials, importing, spending all our money on that, and we are not selling anything to them.
Yes.
You know, that is the mentality that we need to change. We need to look at ourselves, we need to look at things that we can make for ourselves here and utilize it in a very, very cheap way, and a cheap and affordable way for us to use it in all our activities.
Absolutely.
You know, I saw other people, I went to BCC, for example, and I found the washing thing there, and it's got a pedal, and you can
right, yeah, so you don't have to use your
you don't have to use your hand. This was very genius. I said, look, this is good, but we are not thinking of these things all along. Every time that we're washing our hands, we either dip our hands in water, or we put our hands all over the material that we are using to wash our hands.
Somebody's already touched it.
Exactly,
and so on. Yeah. So that's good. So there you have it. Africa trying to wake up. So maybe in the next year or two we'll have oil-producing countries in Africa that actually process their oil and the fuel. They don't send it abroad and then import it back. And who knows, with all the iron ore we have and all the corrugated iron roofing that we have, all of it is imported from abroad. That's ridiculous. Maybe it is time we woke up. But anyway, once again, Issa, thanks for that. Yeah. And now, I mentioned on a previous program that every time one of my reporters has done a story about our borders, they always use the term porous borders. Well, I'm afraid we're going to hear that phrase again, most likely. Have a look at this clip and you'll see exactly what I mean.
Immigration officers have intercepted 3 other boats with more than 40 passengers from Bur. Zakaria Dabo, officer commanding at the Tanje Immigration Post, explains.
As I told you, when you people came here, we told you that we have intercepted some boats. And since when you left also, we have almost intercepted, 3 boats. 2 were quarantined and others, were refused entry. We sent them back. As I'm talking to you this morning, it's just about 30 minutes back, we have also intercepted another boat that is said to be from Bur.
Dabo said the latest boat to arrive from Bur on Tuesday came with 7 passengers who were not allowed to land, but the captain was allowed to refuel and the boat was turned back.
And the boat was turned back. Now, I don't want to criticize our immigration personnel. In fact, I want to praise them. But how realistic is it that they can capture and turn back the number of boats that they need to? There are so many possible landing points around our coast. Yeah,
unfortunately for us, that's it. Like you said, our borders are not...
They're not porous, they're fluid.
So we need to praise them for actually intercepting these boats coming in. I think it's ridiculous for these people to also know that, with all this problem that we are facing in their own country, they will still want to come and provide, give us some other problems in putting risks, risking our country. I think the landing sites and the land borders, there are so many areas that people are coming into this country. For example, just yesterday I was chatting to a friend and he told me that he knows somewhere where the tenants are all Senegalese and they have left to get some stuff from Senegal and they would want to come back. I said to him, make sure when they come back, tell the police that they are from Senegal right now. So you see, we as a country, we as a people also need to be very, very vigilant in these things because we know people who are going in and out. And if we let them in and they come in with this virus, it is not only going to affect them, but all of us.
And in fact, you kind of preempted my point because I was going to say, in the absence of having the resources, surely the vigilance has to be with the public to make sure that if somebody comes in, you record it and you report it.
Yeah, because the last time I also saw a report, was it on QTV as well, but when people were using their motorbikes, going into the borders, carrying people across the border.
Yes.
I do not understand what kind of thing that they would want to do across the border that is so important that they are going to risk their lives and other people's lives. I think this is very serious. We need to praise our security forces for keeping us safe for the time being, and also with the little resources that they have, because these the land borders are very, very difficult to police, and the amount of mobility that our security forces is very minimal.
There are very many challenges.
Yes,
in that,
I think that area also needs to be looked at and be reinforced.
Sure. So there you have it, members of the public. It's over to you. Help the security service do their jobs and keep us all safe. And now, again, as we keep saying, COVID-19 dominates our lives. This story is slightly different, but still related to COVID-19. Have a quick look at this.
The 2,000 rapid test kits will be used to test suspected cases. At the presentation, Basadi Jabi, a businessman, speaks about the donated items.
This is an answer to the call of His Excellency the President that Gambians will support. As we all know that it is not something hidden, it's worldwide. It's a pandemic going on over all the world. And as a businessman, I think it's part for us to contribute our quota. And I know it's timely, and I know it's in safe hands. We are giving it to the people the right people in this country who are going to use it at the best of their ability. And it's also going to help us to fight against this COVID.
I think Mr. Jabi said it there, and Issa had touched on it before. You were saying about people actually stepping up to the challenge to actually donate. And he said, as a businessman, he feels that this is something he has to do. Rapid test kits, I mean, very, very much needed. And yeah,
I think it's one of the most important kits that will be donated. Because you see, in this virus, it's forced to detect it and isolate and try to cure. So the rapid testing would help a lot, because the more we test, the more we know the status of our country.
Indeed.
Because other countries like South Korea, they did massive, huge testing. And this is why other countries are lagging behind. Like the United Kingdom, they're criticizing their government for not testing as much as they should. So the rapid testing kits for the Gambia, if more can be provided, would even be better. So we know, because I saw the Minister of Health yesterday being asked a question on that.
On Focus on Africa.
On Focus on Africa. And his answer also is very logical, that if we had many cases, then we would have seen the results in our hospitals. People will be reporting. So it looks like that we are, for now, in safe. We are for now safe, but we can't be complacent. We can't rest our laurels. We have to be providing these things to be able to test people, particularly those who are coming in. So we can allow people to be going in and out, and we could be able to test them quickly and know whether they are in danger of contracting this virus or not.
And you're right, because particularly with sort of rapid test kits, if you have them at border points and you have health officials at those points, they can actually test people. And I'm not sure whether that particular one, but there's one kit which gives a result in 10 minutes. So I don't know whether that is one of those, but certainly it will be welcome, particularly at border postings. So
if that is available there, then it will make life very, very easy for people, and economy can start growing, and less people will be needing food aid. Indeed. So
let's hope that this is something that, as the gentleman, Mr. Jabi, said there, he knows it's going to the right people and it's in safe hands. Let's hope that's the case. We'll take another quick commercial break, and when we come back, we talk about International Workers' Day and how it was commemorated this year. Join us after this quick break.
tey nag sun street stock bi ak Inco la kaay la ñu xool liggéeykat bi ak bagage Inco. noo gisee bagage boo use ni
bagage bi dëgër na garanti na yaaga na ak Inco dafa mel ni yaa ngi téye àdduna si sa loxo.
non macha allah suma liggéey bi peeli Inco ak pusi Inco macha allah gaawal liggéey dara nga peel doo si soona.
ñun welda mane de bagage Inco lañ dee gën a use because moo gën a wóor.
ñun mi liggéey aluminium bagage Inco lañ dee gën a jëfoo cause mooy lu óor si ñun.
ak Inco bagage yu baax leen amee te quality lii mooy seen brand lii mooy seen kola foo mu di gis bagage bu baax rek Inco la ma ne ak Inco si nekkee private sector la government sector individual képp koo xam ne rek da nga bëgg a sampa wala welda man nga maçon nga kapinta nga kaay Inco dinañ la jaay bagage yu baax te correct te seela te bagage yooyu noonu nag dafa ànd ak garantie ak Inco aduna bi mu ngi ci sa loxo.
Little olive, little onion blanc, little mustard, little mayonnaise. Little Kitchen Express, waañ yépp ay bànneex la.
Welcome back. And in many parts of the world, the 1st of May is celebrated, commemorated as International Workers' Day. This year there's been very little celebration, and have a quick look at this and you'll see what happened here in the Gambia.
Workers were affected by the coronavirus and its layoff and the lockdowns and closures to be giving the required financial support by government, and also in kind to the vulnerable elements, and subsidize also the commercial transport industry. And the other thing is for government to provide adequate and advanced surveillance, equipments to the Navy, so that they will be patrolling our coastal, borders. Likewise, the immigration and the police, so that they will patrol and control also our porous borders.
He talked about controlling and patrolling our borders, which we touched on, but he also mentioned about other things that, workers' rights and so on. But traditionally, that International Workers' Day has been commemorated with sporting activities here in the Gambia. Isn't that the case?
Yeah, it is. Actually, the sporting activity emanated from an idea from the National Olympic Committee, who thought that they would be able to gather workers and they celebrated by doing sports. Okay. There has always been the labor groups who were coming out and talking all the time. Most of the times, actually, they are not listened to, but this year we didn't see that kind of a thing because of the social distancing measure that we have for here. Yeah. But I think also I was talking to a friend and I was telling him, well, these companies and government institutions have been budgeting for this. Yeah. Where is the money? They should donate it to government.
Is it going to be diverted? Who knows? Perhaps some of them donated during our telethon, GCCI telethon. Who knows? Yeah. But I think you're right. Again, we say this has impacted everything, and as you rightly mentioned, the sporting activity would have been the big thing where they brought people from across the country and listen. So yeah, COVID-19. Sports, everything. And I think the next story that we're going to go on to actually also touches on that, how it has impacted sport, not just here, but around the world. Have a look at this.
So the earliest we can play is in September, October and November. We have 4 games to go, and I'm sure that all the players will be fit. We are leading our group, and there's no doubt that when we start again, when we have the availability of our team, that we will be competitive to fight for our qualification spot.
Now, I chose that story and I'm smiling because there are lots of fanatical football fans around the world. And one of my reporters was saying that in terms of sport, football has been the most impacted. And I said, well, hang on a minute. They've cancelled the Olympic Games. So it's not just football. But, Sanfier was talking there about, possible resumption. But in some countries, in Holland, in Belgium, and in France already, they've cancelled the league and actually awarded titles. But in England, there's a huge debate
Yeah, maybe because of money involved in it.
Not maybe, and that's what they're saying. It's about the money.
Yeah,
yes.
It's about the money, and there are others threatening to sue.
That's right.
We've heard about that. In the Gambia also, we are affected internationally because, for example, we had a chance of winning a medal in the Olympics with Gina Bass, and that's been cancelled. Now that is going to take her another time to prepare for another Olympics. Yeah.
Yes.
For our football too, local football has been affected, and now I understand that the football authorities here are looking at ways and means of how do they go about reorganizing the league, but there are also some differences there. But COVID-19 actually has affected every sector of our lives, and it is going to continue to do so, because I had the aviation industry complaining that it would take around 3 years before aviation could be back to where it was in 2019.
That's right.
So it is going to be a very, very big problem. We are not going to feel all the economic problems now. It is going to take some time, but we will see it.
And it's an interesting point you made there, actually. I know it's not necessarily directly linked to sport, but I think it's worth investigating, because in terms of tourism, when you look at the fact that when COVID-19 happened, there were lots of tourists who were stranded here. And just a couple of days ago, the last of the British tourists left, the ones who, they sent a couple of planes to repatriate people. But a lot of them were saying that, next year, when they would have thought of coming here on holiday, because they've had to take a loan of £600 to pay for their flight, they probably won't be able to have a holiday. And so they'll stay in England, or it's England, Scotland, Wales. There were people from all of those places there. So that is really quite an impact, isn't it?
Absolutely. You see, tourism, it has been very unfortunate with the collapse of Thomas Cook, and then, this thing coming. It's very, very serious. And that is going to impact on the unemployment issues that we are having here. Right now, we have a huge unemployment problem, and the tourism industry is one of the biggest employers in the country.
Absolutely.
And with this happening now, it would look like that the numbers are going to go even higher in terms of unemployment. The tourism, as in terms of the income that it brings in, also in the foreign exchange, it's going to affect it. This thing, the impact of this COVID-19 is going to be massive. We don't even know the extent it is going, because we're still battling it. We don't know how far it is going to go,
or how badly it's going to affect this country. Never mind the economics.
Because you see, our economy is linked to the big economies around the world. For example, the United States is still struggling, and they say when America sneezes, the whole world
catches a cold.
So so that is going to be a problem. We are going to be seeing some massive impacts on all sectors of our lives in the coming years.
Sure. And now the reason I chose that story is because Gambia seems to have gathered a really good national team, Scorpions, leading their group, albeit after only 2 games. So there was still 4 games more to be played. But it also kind of mimics what's happened with Liverpool in England. 30 years they haven't been champions of England. They're leading the league by 25 points rather. And now all of a sudden, apart from the top 6, apparently, according to all the British newspapers today, the rest of them want the league voided. And nobody declared champion. I mean, which and that's that's totally to do with COVID-19.
Yeah, that's the England situation is serious. Our Gambian situation, because when COVID-19 first hit, it hit Italy very bad.
Yes,
and most of our players were in Italy. So people here were very worried, saying how would we do this, and all of a sudden it starts spreading all over the place. And many people are saying that this is the best chance that the Gambia has to qualify for the World Cup of Nations. And with this happening now, we don't know what is going to happen in September, as the coach said, if we are to play around the time.
Yes, I mean, when we ran the story, I think I upset my colleagues by saying if they can cancel the Olympics, they can cancel AFCON and say, have it played another year. Or move it so that the matches that are due to be played get played, and it just gets shifted to another year rather than the year in which it was meant to be taking place. So the impact really could be quite deep, because we've assembled one of the best teams that the Gambia has had. As you rightly say, many of our players are playing in Italy. It's been one of the most badly affected. We have a couple in Spain and in Belgium and so on. All of these have been played, and Gajaga, when he did the story, actually mentioned the fact that even if they resumed in September, October, November, a lot of these guys would not have played. They wouldn't be match fit to take part in that's surely has to be a consideration as well.
Yeah, I think it is going to make a lot of sense if they try to move the AFCON. Since it has happened with the Olympics, they could do that as well. So it can give all the teams the opportunity to prepare better. And probably Gambia could have a chance to consolidate their lead and make it a reality for us, at least for once in a lifetime.
Absolutely. Let's hope we live to see that day. Thank you, Issa. And now on to our final story. And again, this one, again, it's definitely yet again linked to COVID-19. Slightly different, but I think it impacts all of us. Have a look at this clip.
The statement added that the goodwill gesture is aimed at bettering the cost of fuel on transport operators in the light of the executive directives to limit the passenger capacity of commercial vehicles. Since February 2020, the government has made a cumulative reduction of $12.62 is 25%, $11.94 is 23%, and $19.23 is 44% on the price of petrol.
Now, it's you heard there when you look at the reductions, they're quite big.
Yeah.
And yet people are complaining that they're not seeing it in their fares when they go and take commercial vehicles. For you and I, if we're driving our car and we're filling it up, it's a huge difference to have that sort of reduction. But I mean, is there any justification for people in commercial vehicles to keep fares pretty much as they were?
If the commercial operators were actually heeding to the advice of the government to take half
limit the number of passengers
and not increase the fares, I would say it's fair that people should still pay the same fares. But the transport, commercial transport, were not doing that. They were actually either overloading or charging exorbitant fares, or actually doing tricks that people will pay more money.
Yeah, saying
so for
I haven't got change when you give me 10 and it's supposed to be 8.
Exactly. I think they should reduce the fares because they have not suffered that much. When this thing came, and people were complaining that at the pumps the fuel has not been reduced, so why are they going to allow these people to take half? I said, well, everybody is suffering. There are people who going out getting things, they're asked to sit down.
Yeah.
They're not getting anything. So the transport, commercial transport community should understand that they too should take their fair share of the hardship.
Sure.
Now that this thing has gone down, I think they should also bring down their fares. I think that's the fair thing to do.
And a point you mentioned there, I mean, from Airport Junction, Coastal Road, right up to Turntable, which is kind of some of the routes I take when I'm going home and coming to work. I've been quite impressed with the fact that they've got police on motorbikes stopping and forcing taxis and minibuses to divest passengers, to drop passengers because they got too many. And so I've seen that in the last week or so, and I've been quite impressed. I think, gosh, because as you say, some of them have been overloading and still charging pretty much.
They were doing that a lot. And you see, because the police normally would create a pattern, and these drivers will understand that pattern. So they would know that the police would be around this area from this period to this period. So if that happens, the way they do it, for example, if they're coming from Turntable going to Brikama, for example, they'll say they're going to Coastal Road.
Yes.
You pay for Coastal Road, they say they're going to Airport Junction. Airport Junction, they say they're going to Busubala. So that's what they are going to be doing, because the police can't do anything, with that, because they wouldn't be able to tell them, no, you can't stop here, you have to continue. So if they know the police are not around, then they overload or they even overcharge. That's how they do.
Yes, and I had some of my colleagues saying that once they would have taken a single vehicle, and now they're having 3 and in some cases 4 vehicles, and of course it ends up costing them more. I mean, that's hardly fair. But I mean, in terms of the prices that's been reduced, do you see them coming down anymore, or do you think we've reached as low as they can go?
I think it's gone to the lowest because I think the reason why it came down, not because of government's generosity, is because the oil prices actually went to zero when they couldn't store it any longer, and there was this dispute between America and Saudi. You have to reduce oil.
That's right.
We understand Trump, actually played the economic card. If you didn't cut down production, we are going to stop military support.
That's right.
And there was this dispute between Russia and Saudi Arabia as well. So we know as soon as these big guns settle down in the way they want to control the oil, it is going to come up again.
Yes.
So this is just going to be temporary.
So we're like the grass. They say when two elephants fight, it's the grass that suffers. But I think it surely has to be a good thing, because I think, as you rightly said, there are many people who their own economic activities have been reduced and sometimes curtailed permanently, but they might still need to travel, and so they don't need to be paying, what they were paying, I don't know, 3-4 months ago. So I think for them also, so although it directly sort of benefits the people running the transports, the taxis, the minibuses, the passengers also must benefit eventually.
They must benefit. I can tell you, yesterday I was trying to buy a piece of equipment, but the guy I was trying to buy it from was telling me that he can't open his shop because he's going to be, arrested by the police. So we had to be, doing that cat and mouse to see where we can meet so he can give me the equipment so I can give me, because I needed it badly. So people like that have been suffering. And the transport, like I said before, the commercial operators should also understand that this is a period that not everybody is enjoying. So they shouldn't use this opportunity, to make more money, because that's what they do. Whenever there's crisis, the commercial vehicle owners would inflate prices, or they would play tricks that would make people pay more money. For example, if you close at rush hour from Westfield going to Brikama, it's a nightmare. It shouldn't be like that. There are too many transport that are plying our roads that we shouldn't be suffering like that. But I think also, to look at in a different way, I think the government or whoever, we should be able to provide proper public transport system in this country, like the GTSC is doing.
I think that's
I think that needs to be done, and that is going to control this madness that we are seeing on our roads.
I think that's a great point to end on. Isa, thank you very much. And so I'd just like to say we've come to the end of the show, and a big thank you to my guest, Isa Jallow, for joining us. Isa, thank you for coming along. And join us again next week, same time, on QTV for the Week in Review, where again we'll go through some stories. And as ever, thanks for watching, and if you enjoyed it, tell your friends to tune in. Thanks again. Bye for now.